going to be looking into the future of healthcare, the future of healthcare technology. I wanted Dr. Shepherd on this panel because she's a practitioner, but also working in advanced medicines as well. We're also joined by Gautam Dr. G. Gulati? Gulati, I'm sorry for that. You even told me that before. And David Liu. They are both very accomplished, both working in this field and also on other fascinating projects. David Liu, you're a surgeon, you're a health tech entrepreneur, the CEO of Hearty and the Heart Fund, and Dr. Gulati, the speaker, author, and founder of the Well Home and the Gulati Group. But you should read their blogs. I was doing some research, some fascinating stuff coming up, and I'm so glad you're here for this conversation. Thank you so much. Let me set the stage a little bit, because spending on healthcare is only going up for obvious reasons. We have the inflationary aspects of it. We also have the demographic parts of it. But we're looking at a projection of $370 billion in increases in just the next 5 years, according to McKinsey. From 2025 to 2030, it's going to increase another 5.3% a year. That's $6.8 trillion on spending on healthcare. So I want to talk about the places where this is happening, and the places we should be looking at both as practitioners and as potential investors. And I'm not looking for stock picks, but let's look at the sectors where a lot of this is happening. So I want to start with the one that has been front and center in terms of COVID treatment. That's mRNA developments there. Let's go down the line here. I know it's been critical, but what's happening there beyond what we see when we go into our CVS or our Rite Aid for our shot?
I mean, look, first of all, this is amazing to be on this panel. So I want to thank you for the invitation. The only thing that I think is really important to understand is 90% of what you just talked about, the $6 trillion, is coming from preventable chronic diseases that are related to age. Unhealthy aging will drive the major cost of healthcare in this country. And so, as much as I love all the technology and mRNA and gene editing, I think the major investment should be focusing on what we don't treat today, preventing the age-related chronic diseases. Yeah. That's the number one priority of this country. So I think in terms of future, if you can pick the companies that are really focusing on making sure this addressable market, which is 90%, right, is solved, you do good. Yeah. However, I think there is something really good on mRNA. Right now, there is the phase 1 clinical trial for HIV, right, in Rwanda, in South Africa. So I think the future would be some of those infectious diseases that we couldn't solve, treat, or even prevent before, like coronavirus and COVID disease, will be solved. And so the next maybe decades, we won't be facing some of those, I think, pandemic eventually, right? Or we will solve them faster. And so, like we said, and like we've seen, now it used to take 10 years to develop a vaccine. It took what? Several months, right? So without going into this debate, what I'm saying right now is there is technology that can eventually solve the acute diseases, right, that you can die for. And then as well, the technology that could help prevent the disease that you shouldn't get, right? And that's the big part, I think, of the equation. How do we solve this equation? And the one are focusing on that, probably going to be really successful.
Right, and all three of you really are about wellness writ large, even though you have individual practices. I know Dr. Shepherd has a very specific practice, but really across that through line is wellness writ large. How do you feel about that preventative, taking care of the things that are going to keep us from getting sick as the focus?
Well, I do think that's an important piece of where healthcare and medicine needs to go and away from our existing sick care system, which is what we do. In today's environment, I think healthcare today is really focused on the what. What are we diagnosing? What are we doing for the individual? We really need to be focusing on the how. How are we going to get there? I think prevention and wellness plays a big factor in that piece of healthcare. But I do want to take a step back and address some of the stats that you shared initially and really separate the forest from the trees here. So a lot of the work that I do is in the future now business. And what I mean by that is studying patterns of the future that are going to have impact for us today. And in doing so, you have to look at paradigm shifts, right? And in paradigm shifts, you tend to go 3 steps forward, 2 steps back. And usually to conduct a paradigm shift, it's multi-generational. And we're sort of in the midst of a paradigm shift in healthcare. And paradigm shifts are messy. And I think Andreessen Horowitz a number of years ago talked about the unbundling of certain industries. And sort of that's what we're in right now in the world of healthcare. We're unbundling a system of healthcare that's been inefficient, that is broken, and still broken. And we're creating little pieces of innovation within that system now, and then going to rebundle it back together. You can argue that we're sort of in a rebundling phase right now, and we've gone through about a decade or a decade and a half of really messy innovation that has increased the cost of healthcare overall in our system. But I think it was a necessary step to get there. So even if you look at mRNA vaccines now going down to the trees, that's a technology that was developed over 20 years ago, right? We're just now seeing the application of it that happened to be as a result of the pandemic and COVID. And now it accelerated this innovation in a number of different fields, but even still, it was a messy process, right? There were behavioral changes involved with it. Can we trust the data? We're used to science taking 7 to 9 years or trials taking 15 to 18 years to develop, and now you've got these vaccines being developed in under a year. So the science is incredible. I think there's the technology element of things and then the human element of things, right? So technology is easier to do. The human adoption and the behavioral change as a result of that is much more difficult to do. But to me, when you share those statistics, it actually tells me that we're in sort of an environment that is undergoing an active paradigm shift, that we're advancing the industry in a forward direction of where it needs to go.
Dr. Shepard, you saw patients over the past few years. They do need to come to your office for a lot of what you do in your OBGYN practice, but there's also this growing movement of care at home. Some of that is preventative, some of that is just virtual conversations. How have you noticed in your own practice this shift, and how are you shifting to adjust to what your patients need and want today?
I think there are multiple aspects of that. One is the delivery. I think, we can all attest to how we learned medicine, how we were trained to deliver the messages of disease and health. And a lot of times that was really pulled apart in a way where we only really discuss it in a disease way when you actually have the disease. And I think that we are starting to change those conversations. But again, it's exactly what you said. It's the actual way that we deliver, how we speak, those conversations. That is probably the harder part of it, because when you're talking even just about mRNA, that really is an expanding that we see in therapeutics, RNA therapeutics in general. And what we're starting to see is not just from a vaccine perspective, but even entering it in a way of a personalized medicine way, and how it can be used in many different aspects of healthcare. And so I think back to how that conversation is changing is the delivery of the message, which I think healthcare providers need to change the way how we look at disease and how we share that information in a way that's engaging, empowering for patients, but also creating this atmosphere where they also too want to prevent disease. And then I think from a society perspective, there's so many different ways, and how we have this different messaging of, and speaking to us on the stage because we're here, of how we think of lifestyle, how we think of prevention, but we are kind of fighting a battle with the things in society, such as just food in America. What's put in food, our portion sizes. And so we are dealing with these kind of giants of environmental concerns, what we put in our body, decrease in movement and exercise. And so those again, so it's kind of like this, we keep missing the mark sometimes. I am very optimistic that we will get to a place where, how we provide food in America, just even that one topic, how we provide food in America and what's available for people will change. And then also the delivery from the providers and how we approach wellness and prevention of disease. And I think once we get more on that wavelength, we'll start to see that. But we are kind of a lot of up and down right now. So we kind of need to stabilize the conversation, and also from society perspective, what we put out for patients to be able to access.
Great point. You mentioned giants. I want to talk about some giants that are moving in or have been moving into the healthcare industry: Amazon, Google, Apple. They can do a lot. They have a lot of capital, and they are very connected to our lives in so many ways. So what have you noticed as sort of how that the tectonic plates have shifted as they have entered the marketplace? And they've done it through a variety of ways, through wearables, through just the data, through listening to us at home, but also Amazon wanted to get very deep into healthcare delivery.
Look, what is really interesting is, and if we talk about the future of healthcare, first of all, that would be the future of health, right? Because you don't want care anymore because you're healthy, right? That would be the future. And the future wouldn't be tech, right? The future would be low tech or no tech. If you look at all the blue zones, and the blue zones, I don't know if you heard of that, there are the countries or the cities in the world where you live up to 100 years old, healthy, right? So talk about lifespan, which is longer, life expectancy, and then health span, which is the healthy life expectancy. So in those places, Okinawa in Japan, Sardinia, Loma Linda in California, in those places, people don't have Amazon, right? They don't have an Apple Watch or a Ring, or they don't have anything.
They're not counting their steps on their Fitbit.
Exactly.
So these are the countries we need to possibly move. There's going to be a mass shift after this panel.
Exactly.
of
You
people
know
moving
why?
there. Yeah.
Because it's embedded in their behavior, right? They're washing the kitchen, they're planting, right? They're gathering with their friends. So they don't talk about healthcare. They just live health, right? So the same way we say we need to invest in our, what is your wealth portfolio, right? Their portfolio of health there is all the bucket that you need to fill out to make sure you live longer. And so that's where I'm pessimistic in a way, because we think about Amazon's going to solve it, that we providers will solve it, right? We won't solve this until we solve how we behave and how we think. And so I would think the number one investment that everyone here, right, as every human should do, is understand your brain and how you behave in a society, right? How do you react to what you hear in terms of food marketing, for instance? How do you react to external triggers that's going to make you drink more alcohol, right? How do you think about behaving every day so you can teach your children, right, the future of health? And so Amazon is trying to get in healthcare. Apple is now going to be probably a health plan, right? So if you look at it, it means that data drives health. The data is what? Knowledge. So if we understand, right, our body better, right? We don't have to give the data to anyone, right? And that's a little bit counterproductive because I'm building a tech company. But what I'm saying is your health is free. Those buckets of eat better, sleep better, manage your stress better, love your community, what you do, your partner, and your children is health. So I think indeed the future of healthcare will be probably those big companies, and now they're acquiring other companies. They will acquire a hospital. TikTok acquired the largest Chinese hospital.
Did I miss that?
Think about that now.
Wow.
Wow.
So if you look at WeChat in China, when you open WeChat, it's it's super app, and so you can book not only your fast food, right, your doctor, your cab, everything.
All in that order, too.
But now TikTok's going to know everything about you because you dance on TikTok. So they know exactly what happens in your home, what you eat, how you drink, are you overweight, do you healthy. So they'll be able to direct you to your hospital.
Dr. D, future cast that out for us now.
Well, I mean, I think we tend to think of this stuff as very binary, right? Should we technology? Should we not technology? What's going to matter more? I think the answer is it's going to be yes and. It's both of those things that ultimately matter, because in order to get to the human aspect of low tech, we need technology and tools to understand the data to get us to that level. So there is sort of this combination of both that's required. As far as the big tech companies coming into the space, I'm not surprised by it, because we as a healthcare system, the incumbents, have essentially dragged on for so long. And it's a multi-trillion-dollar opportunity. And so they're, of course, all going to try to jump on the bandwagon and try to get their piece of the share of healthcare just like the rest of the world is. And there's a lot of inefficiencies for them to grab on. You can see the verticalization happening with PBMs and retail pharmacies, et cetera, trying to hold their ground, going against the Amazons of the world that are trying to break that model, and the Mark Cubans of the world trying to break that model. But my love-hate for this element of the big tech companies coming in is, the incumbent companies in healthcare have tended to approach their services as we have a product and we're looking for an audience or a patient set to deliver it to, right? It's like we're a data company looking for a customer here. Whereas what a lot of the big technology companies like Amazon and Google's and Apple's, they approach it from a customer first standpoint. And they say, what as a human do you need? And do we have the capabilities of being able to deliver that? And it's a very different type of approach and solution that you get. And the reason why I'd say Amazon is to some degree being very effective in the approach that they have taken, but of course spending or losing millions of dollars in the process of doing so. I think the ultimate lesson here is it doesn't matter if you're a new co-startup with 5 people or a multi-billion corporation, it is really hard to do anything in healthcare. And I'm just rooting for anyone who can actually make it possible and better.
Yeah. I'd just like to add one thing. Look at the latest news about Amazon. They closed Amazon Care.
Now, why do you think that happened? Because they
Because I
didn't see
think-
a path to making money there, or too complicated?
Well, they bought One Medical too. That was kind of,
There is something here. But remember as well, Amazon, JP Morgan, and Berkshire, when they created Evan, led by one of the best thinker about healthcare, I told you one day, they closed after 2 years. So what I'm thinking is, I don't have the answer, by the way, I don't know. But my gut feeling is people want someone that's really going to care for them, for their health. They don't want another Amazon to deliver, whatever they can deliver now. It's good. It was good for, I was a big Amazon customer, but I don't think they were able to deliver the care in a trusted way. They were thinking now, if I go to Amazon, not only they're going to deliver the care, but they're going to deliver the drugs, and that's why they bought, what's the one they bought? Capsule, or the other one? Like the virtual pharmacy, right?
Absolutely.
So I think now they have One Medical, they have the delivery, so they're becoming fully integrated. So now they compete with a large healthcare provider. And that's where now you lose the trust. Do you trust a healthcare provider or do you trust Amazon? So that's my gut
but we
feeling.
also love the experience of it, right?
Right.
So, which makes it more convenient. You go through our healthcare
did you
system,
try?
you have to
Did
go
you
to this
try
lab
Amazon
for
Doctor?
that, and then you have to go through. No, I haven't yet.
That's
but
the thing. So that's the thing, is that would you try it?
I would
say,
try.
could you say?
I will try anything. I'm
you
an
need
innovator,
it.
so for me, I'll try anything. But at the end of the day, I think that's just a step function for them to get better at what they do. You're not going to be perfect when you start off. It may not be the perfect solution when they get off the ground, but I think they'll get there eventually.
Yeah, Apple, is bringing, all the different tools.
Sure.
And I think it's amazing. I think you need to drive the movement of, empowering people.
A lot of it comes back to something you brought up in the beginning of that, which is data, right? Still shocking that I have to pull out a vaccine card that has been written on now, but still.
But didn't
data.
you love the feel of the paper?
I loved it, and
feel of your
I carry it.
card?
It's on me right now.
Right.
Jess,
Yeah.
telemedicine found its moment during the pandemic for obvious
did.
reasons. Not all practices can use it. Not all forms of medicine can use it. But in your own practice, have you noticed just it's much easier sometimes to say, actually, we just need to talk, and what percentage of the visits now are televisits versus come in, I need to see you and check you out?
I think it was amazing. I remember during the height of the pandemic when we really did not know what was going on. Hospital systems had to, most of my time I spend with patients is in the OR operating. So we had to shut the ORs down for a good 3 weeks, 4 weeks. And during that time, we had just this quick moment to pivot and figure out how are we not necessarily going to operate, but how are we still going to service those patients who may need a procedure, who have some type of emergency. And telehealth really became that vehicle in which we could talk to patients, interact with them in a way that we're still seeing them and maybe not getting that touch through what's really important to medicine. And I think that's alludes to why Amazon may not have captured that, is that at the end of the day, people really want that human interaction when they see a provider. And so through telehealth, I can definitely see the convenience of it. I would say that a lot of my patients, when I really look at the type of visit that's needed, it doesn't necessarily mean that they have to come in the office, which allows them to have more flexibility with their time, not having to take a whole half a day off of work to get there, to sit, to wait, and et cetera. So I think that there is this shift in balance, and I love that you used the word love-hate when we were talking about these big Amazon and Googles, because I feel the same way, and I think that medicine, historically had that love-hate for telehealth because many hospital systems were not on telehealth platforms until the pandemic happened, and that's when we saw that immediate shift. So I do think that we are seeing that turn in society where we're able as providers to give care to patients in the same way, I would say, through telehealth, but we still ultimately want that human interaction. So I think that telehealth is here to stay, but I do think that that's the beauty of medicine, is to be able to interact with your patients on a really personal level, to be able to see them, touch them, interact with them in a room setting that builds that confidence in the relationship to therefore get the patients the care that they need.
Yep. Let's take telemedicine a step further into the virtual reality care. And we already have this now where doctors in Israel can operate on somebody here, remotely.
Can we do it from bed in our pajamas?
Absolutely. It depends how steady your hands are, though, because I will want a steady hand on that operation. Do you see this, Dr. G, as becoming more prevalent over time, or is that something, given what we've been through, that may not have the legs we think it might have?
Well, I mean, I think we need to sort of understand the lexicon of what some of this technology means, right? We see words like metaverse, we see virtual reality, there's augmented reality. Apple wants to come out with Apple reality, whatever that's going to mean. But I think, each has their own place, right? We can't really use them interchangeably. I think they're different types of tools for different things, just like machine learning is different from AI, yet we tend to use them interchangeably. Virtual reality, what we've seen so far from an educational standpoint, has been really transforming, right? Like really, if you look at some of the surgeons, Dr. Shafi Ahmed, who's in London, he's conducting surgeries with now tens of thousands of students looking at his techniques. I think it's been really effective in those types of use cases. I think we're still sort of studying to understand where the applications are. I think augmented reality will have a significant play in not just the world of healthcare, but across all
Paint a picture of
industries.
what that would look like from a patient perspective and from a doctor perspective. What in augmented reality, what does that look like?
Well, in augmented reality, let's say, for example, if you walk into the patient room, let's say you're seeing them in person in a clinic, and all of the data is whatever tool that you're using, whether it be some goggles, glasses, contact lenses, whatever that medium is, you're essentially looking and examining the patient and seeing tools in real time, seeing data in real time, seeing basically a digital world of whatever information you need surrounded by your actual interaction. And this is just, these are just things that we can imagine. I can't even grasp the element of augmented reality on the things that we can't yet imagine. I think there's a lot more to come. This is just, not even 1% of what the capability is of tools like augmented reality, even stuff like AI and machine learning, when you apply that to things like augmented reality. But from the patient perspective, in their regular day-to-day life as they operate, there could be things, I think you had talked about, the app that your wife uses and alerts her of certain things. Like you could actually have real-time alerts of, don't eat this, I see you staring at the donut, you may not want to eat that, right? So those are simple things to think about it, but then there's probably much more sophisticated applications that I can't even imagine myself.
So right now, there is some already existing application that you can use on this. This is the next hospital, basically, right? So there is some application that can measure your level of stress, like measuring your heart rate variability, not with the tool, right? Just with the recognition. And so you will see your face and you will see your HRV or your resting heart rate in real time, right? There's some facial scanner right now that can tell you how fast you're aging with validated algorithm. And so in the future, this augmented reality could be in your mirror, right? You would see yourself and you would see your blood pressure, your resting heart rate. That will be for the patient. But today there is already, when you work in ER or in the operating room, you can put some Google and reduce your pain, right? Fight your phobia, your anxiety, right? They put you in the world where you get exposed, and that's behavioral science in a way, and you get exposed to spiders, right? To make sure that little by little, you can fight your phobia. So when we're talking about mental health, and depression, VR today, I think, could really help on those topics. In the future, maybe you can operate, do open heart surgery. This is not yet today, but That's where it's going. So I think it's really helpful today.
We were talking about mental health earlier, and it reminds me, I know that there's a lot of intense pharmaceuticals that treat mental health. Many of them, and many companies have made a lot of money doing that. But I also see that there's a company now creating an electrode scanner that you put on your head that flashes some scans and lights into your head, into your eyes, that have a similar effect, and sometimes a better effect without taking the medicine. Where do you see that type of technology going with other types of treatments?
So I'm not an expert in this, first of all, but what I can tell you is the analysis we get, basically we call that the real-time biofeedback, is analyzing the response you get from a signal. And so if you put an helmet that sends something, right, let's say a wave, and then you can basically collect some information from your body, means data, in real time, then you can see what works or not, right? And so I think that's kind of where we are right now with all those technology. You can get some, wave, you can listen to, beta wave, alpha wave, and try to now hack your brain the way it works, right? Reduce your dopamine, access in a way. And so that's, I think, probably with psychedelic, one of the growing area where now we can tap, and that's what I was saying, invest in your own brain, understand how it works, right? We understand probably like 20% of the brain right now, right? Don't quote me on the number, but that's where I think is really interesting. We're gonna have technology that can now push information and collect information and personalize it for what you need. Depression, anxiety, or performance.
I wanted to add to that as far as personalizing and individualizing medicine, but also you seeing that through the stages of your life. As you age, your cells respond differently. Your idea of what is stressful is different to when you're in your 20s versus your 60s. So that's really where I see the implementation of technology with health is one, we can kind of lean away from the quote unquote westernized medicine with always having some form of medication to take with the disease state or condition. Moving away from that, because I truly do believe we have a way to heal our bodies, but we have to tap into it. And I think technology has the ability for us to understand the variances between gender, between ethnicity, age, and all other variables as well, to help the patient understand what they're going through and how they can adapt to it, but also a way for physicians to trend now when someone has an issue, how they may be getting better, getting worse, and help them move through that, again, without having to necessarily use medication. I really do believe that there is a great way to get there. Do I think we're there? No. And I think, at the beginning, there's always this impetus to look at it from a financial standpoint of how much can a company, monetize on that. And that's what you'll see across different, issues or inventions is that part first, which is very important, but I'm waiting for the end part where we can merge the actual outcome and effect that it has on a population, and when we can start to see those metrics improve overall health. This is just a selfish moment. I wanted to ask you about the Well Home, how that, when you're thinking about aging, isn't that somewhat a form of technology working to age, to work with aging?
Yeah, tell us what the Well Home is first, and then tell us, and then you can answer a question.
Very simply, the Well Home is interior wellness designed for people living with chronic conditions, right? And really to sort of put that into use case, it stemmed from a personal experience that I had with my father back in 2013 when he was diagnosed with Alzheimer's, and he had a rapidly progressive form called Lewy body dementia, which is where your motor capacity essentially deteriorates faster than your cognitive capacity. But you don't really know that until you're actually in it. And so over the course of time, as he progressed, both my parents moved in with me and I became the primary caretaker for him. And as a medical doctor, I was fully equipped and trained to understand and get him the latest clinical treatments and guidelines and the best access. But where I was really blindsided was how much of care was actually required inside of the home itself. And what I realized is that the healthcare system really abandons us when we need them the most, and that's when we're living with our illnesses on a day-to-day basis in our homes. So very simple questions of if he's at, when is he at fall risk, and are there tools that I can utilize to track if he falls and I'm not home? When is he at flight risk? Are there security parameters that we can put on our house to keep him from walking out the door? when there's a common term in Alzheimer's called sundowning, where in the evening you tend to get more agitated for whatever reason. They don't really know the pure science around it, but we know certain things impact that, like circadian lighting and different materials and paint colors. And can you create routines in the home if they forget where they're supposed to go inside the home? So all of these things directly impacted his outcome, his healthcare outcome and quality of life. But this is not part of our healthcare ecosystem. This is not how we treat patients, nor are we trained to do that, right? This goes back to we're trained to figure out what, not necessarily the how. You're left on your own sometimes to figure out the how. And so the Well Home was really designed to figure out how do we live and better design our environments for things like migraine, asthma, Alzheimer's, if you have children, autism, or even, I think somebody brought up, baby-proofing the home and items like that. And truly so, I believe if our habits are formed by how we inhabit the home, then we can design our way out of sickness as well, right? And that's what the Well Home's trying to achieve.
I want to turn to an unpopular part of healthcare for both providers and for patients, and that's billing, healthcare payment trends. Nobody enjoys that part of it. A lot of it's because our data is everywhere at the same time. We go in not really knowing what to expect. It's like, again, going to the mechanic and him saying, oh, you don't even realize. It's not just your brakes. Your whole suspension's broken. But we're looking at billing, digital intake forms, patient billing, engagement, experience, telehealth, telemedicine. All you want to do is practice medicine. That's the whole point of getting into the business, but you end up running a small business. Jess, from you, what's been the most innovative part of billing that has helped your practice, or what do you wish was out there that could help your practice and give you the time back?
That's a loaded question. Man. So trying not to be angry about the answer. Exactly what you said. We really just ultimately, at the end of the day, and I think sometimes we actually forget this as providers because we're so in the weeds, is that we really just want to care for patients and we want to see them do better. But there are so many things that have caused all these obstacles, taking time away from seeing the patient, taking time away from being able to call them on results. And someone had mentioned earlier on a panel about the physician used to be, I think it was you, Shamar, just the person in the community who is the patient advocate, but also knew how to take care of disease when it came about. And that's really been stripped away from the relationship between patients and physicians. So to answer your question, I don't really have an answer. I would say that we are still in this midst of an insurance-based healthcare system that dictates what physicians can and can't do, even to the point of billing, that has really kind of put a bad taste, I would say, and it's going to be very transparent, in the mouths of healthcare professionals, which is why we start to see a lot of burnout, which is why we start to see a lot of physicians leaving actual clinical medicine, is literally could be just that barrier right there of the insurance model, billing, revenue, and how we're taken away from the actual joy of practicing medicine.
I think if I can add to that, I think you got to, if I were to give it a grade system from, billing standpoint from a provider, it gets an F. Billing standpoint from a patient standpoint gets an F, right? It's F all around. And EMRs are essentially glorified billing systems, right? Electronic health records are glorified billing systems. So we can't forget that that's originally what they were created for, right? Now we're trying to retroactively fix what was a broken technology. We've got these massive companies like Epic and Cerner, et cetera, that basically have dominated the space and don't allow new players to come into it. And it's hard to switch, to be honest. So they're trying to retrofit something that's meant for billing into something that's beyond that, and it's not really working very well.
Yeah. It's always a sensitive topic, of course. So when you talk about billing, is basically increasing the revenue of doctors, right? And I think Kristen said something really interesting. The millennials doctors right now, the Gen Z doctors, they may not want, increased revenue. They may want freedom and time, right? So how do you practice medicine to get more freedom and more time, while still practicing the medicine you love and you sign for, right? Helping people, saving life, keeping them healthy. And that's where I think the equation is going to be interesting, because years ago, they said, all the big fours, let's come back together. Let's build those health, whatever, data pathways so we can bring that into the EMR and we understand the CPT and the code we can send to health insurance. Maybe we will shift to something that is more personalized, where everyone here wouldn't have to knock to the doctor's door and expect a fax. It just changed lately, but accept a fax in 2 months to get your information. And so once you control that, right, we say data is the new gold or something, you own basically your asset. And so I think billing will shift a little bit based on who owns the data. Mm-hmm. And so that's why I empower and encourage and inform everyone that your data is yours. Keep it, invest in it, and make sure you own it. Because today, you don't. Right? Today, you don't. Once you own your data, then you can maybe decide, right, how that's going to work in the billing system. Because everyone wants your data. Amazon, Apple.
Which is why the big giants are coming in.
Oracle just bought Cerner. Why? This is a data play, right? So I think the billing will just follow the demand, like always. Like food companies, right? Big food now are around the table admitting for the first time, I think this year, that sugar is not good.
They finally admitted it?
They did.
That's good.
Right? After how many years claiming that?
100.
Like cigarette, right? Doctors were prescribing cigarette. Now they were prescribing sugar for breakfast. Don't feed your children with cereals full of sugar, please, right? And so I think later that's going to be patient, or before you become impatient, right? Individuals, people own your data so you understand better what your health means. So now you can negotiate with the billing system, the payers.
It's about that understanding. So important.
I think Jeff Bezos has been quoted saying that your margin is my opportunity.
That's right.
So, I mean, talk about the marginal opportunities that you have in healthcare across all these inefficiencies.
All right, let's go out on this, and then I want to take a few questions, if we can, from each of you. What's the latest clinical trial or innovation or development in healthcare that has you the most excited, whether it's within your particular field or not, but within healthcare overall?
Can you give me a minute?
You can have a minute,
You
but I know you're ready.
Well, there's a couple of different things. The ladders to the top are sort of the non-technology related stuff, but I'm really excited to start seeing this merging of Eastern and Western science, because I think it does start moving the needle in terms of the conversation around wellness and prevention, and thinking about doing things in ways that we haven't necessarily thought about doing it before. And then that brings into this notion of the elements of food as medicine, talking about health span and lifespan, and really asking ourselves, do we need to be, conducting science with the same assumptions as we have been in the past? We're starting to see this in neuroscience, with psychedelics, and has always been, outcasted, but now if we just call it neuroplastics or something else, but we're starting to see some interesting developments happen in that space if we just sort of look at historical ways of how we used to practice medicine in other parts of the world and seeing those converge. That excites me the most, for sure.
He stole my answer, but I'm still going to use it.
It's good then.
But no, that's, I left academic medicine after 15 years and started a practice that really was formulated on Eastern-Western immersion of how we can, one, empower more patients to take charge of their lives and the things that they do, as I said earlier, outside of the exam room. Because what I can do in the exam room is amazing because that's what I've studied for so long. But I want to be able to have a relationship where what they take from me, from the physiology and the pathology of their disease or not, and using Eastern medicine. I love the fascinating research that we're starting to see from brain and how we underestimate and how we underutilize the brain, even in chronic pain. How we modulate pain, how we're able to use it in science of pleasure and libido. So I really like to see the science and research behind the brain and how we can utilize the brain, but also really impacting people to use their own body and their own resources to get the best health, and that's what we're starting to see in medicine.
I love that answer.
Yeah, your body's the best technology.
Exactly. I think that's why I was waiting for them. It's a good answer. No, the idea is we own our own body, right? Like you own your finance. And so I think the tools that can really empower you to understand better where you're at right now and where you want to go. I like what you said about your health plan. What is your health plan? And so for all our members, we create this longevity strategy, your roadmap. How do you want to see yourself in the last decade of your life, right? Even if you live up to 100, how do you see yourself? Traveling, holding suitcases, taking your grandchild in your arm? Could you do that? That's the question. But as well, what can you do tomorrow to fix your gut health, your issue, with bloating and poop, right? Or your mental health, or because you can't sleep. That's, tomorrow's problem we need to fix. So what I like about the innovation is how in the last, let's say 20 years, thanks to this internet, data, and like democratizing the education like you guys do, we can now talk directly to the consumer, right? We can tell them, look, you have the choice right now to have either a Calm app for your anxiety, a Noom for your nutrition, a Oura for your sleep, a Levels for monitoring your metabolic health. 10 years ago, you had to go to the doctor and beg for information. That was the top-down approach. That was the white coat, ego. Now, the power is within the people. And they have the choice to influence where the industry will go, right? Because when you have 1 billion people asking for something, I can tell you people listen. The market listen. So I think that's how we create and we empower people to be more, becoming their own advocate. Before that was a primary care. Now it should be yourself.
Power to the patient. Let's take some questions.
Question online. What wearable health tech do you recommend that will actually help with your healthcare?
Oh, I like one.
Go ahead.
This is my personal favorite. I like the Oura. You're wearing one, right? Yep, Oura.
We have.
I think
Everyone got
we
one of those?
minimize sleep. I'm talking to myself too. But sleep is really helpful for outstanding health. And then also Whoop, which is for HRV. I really love that technology as well. So Oura and Whoop.
This has
are my favorite.
HRV too.
Yeah, but if you look at the variability, sometimes Whoop can get a little
It's
bit.
more granular.
Yeah. And one that I use personally is a continuous glucose monitor.
Yes.
Yeah, it's a great
Right?
one.
You have no idea what food does to your body until you monitor it.
I like Vision for that.
Oh my God, this is
Yes.
Or
great.
levels.
So CGM, continuous glucose monitor, there is many brands right now. And you can ask your doctor, sometimes they can prescribe it. And something can be reimbursed depending on if you're pre-diabetic or not.
I agree with both of those. I think CGMs in different forms and any equivalent of the Oura Whoop category. The interesting thing is there are certain things that it gives you more information and data than they can actually claim. Because if they claim certain things, they actually have to go through FDA approval to do so. And it's also very hard to make claims against things that you're preventing disease. But if you understand how to look at some of the metrics that they provide inside of these tools, now we as physicians probably have a better usage out of these devices than probably the average individual. But you can look at a combination of HRV, respiratory rate, body temperature, and look at deviations from your standards, and you know your norms. And if you know the biology within your body, you know that there are certain signals that happen inside your body before you start to exhibit symptoms. And so what some of these wearables can actually do is identify some of those markers that are deviating from normal that can actually signal to you to get better sleep, get more rest, don't eat this way, don't eat that way, move more, et cetera, before you actually exhibit any kind of symptoms. But it's hard to prove.
There's one in the audience as well.
There's a bunch.
Two.
Julia.
3.
As she's getting to that, I wanted to say that, Shamar had said earlier, we're shitty at planning. And these are great ways, these modalities, to kind of default when we fall off track until it becomes a habit.
Right. The technology nudges. Don't underestimate them. They work in investing too, right? Go ahead,
Could
Julia.
we speak to wearables and the data that they generate and privacy issues and things like insurance rates and the ability to get insurance? What is the effect on consumers if these companies suddenly have, buckets of data about your health?
That's an interesting question.
You have to be good. You have to be good. That's the answer.
You have to be healthy.
Fitbit went through that challenge when they provided with organizations, every employee basically a Fitbit, and then the organization, I forget which company it was tracking the movement of their staff, and it was actually impacted, and it was a really heated discussion. I don't know where they ended up landing. I know they don't do it anymore, but I guess it goes back to what David's point was in terms of who ultimately owns the data, and right now, unfortunately, it's not us.
But I'd like to ask to answer this one, because if you look at Apple, like becoming a health plan with an Apple Watch, okay, they own the data, right? But you own your destiny in making sure those data are right and better than yesterday, so you can pay less. So that's how I was like, how do you see the problem, in a different way? Yeah, they have data, but make sure they're good.
Right. You want to talk about the power of data? Look at why CVS bought Aetna, one of the biggest insurers in the country. That's all wrapped up together, right? And now they have their own advertising network within CVS, so when you go in and you buy something, they know who you are. They have the data from that. They have the data from your insurance plan. That is the currency of the 21st century.
I mean, is it ultimately going to be like the car insurance model, Geico or Progressive, or the better you drive, the lower your premium type of thing? I mean, it could be.
Yep.
Yeah,
Yeah.
it could be. I mean,
We got some questions in the back too, but let's get to you, Shamard, and then Alex will make her way, or somebody will make their way up to the top.
Sure, this is a really quick one. So we've always been taught that health literacy for a provider is kind of like the enemy of your practice, right? You never want to be caught, being deficient in terms of what you know. But the pandemic has taught us that we are public health illiterate and we're also super tech illiterate. So do you think that sometimes as providers, even though our heart is in it and we're trying to do the right thing, do you think sometimes we inadvertently harm more than we help our patients?
Yes. Short answer, yeah. I think we're stuck, we are very conservative in how we have our data and we stick by our data, but sometimes there are outliers that we could take advantage of. And I think that's a personal responsibility issue of making sure that you're either staying up to date with technology, research, et cetera, but also looking at your patients and really fine-tuning what is best for that patient at that time in their journey.
I think there's a little bit of an irony playing out in the marketplace where the healthcare industry for the longest time has been built around this notion of asymmetry of information. We, the professionals, know what you, the patient, does not know, and therefore you trust us. But now the asymmetry has been an even playing field, right? They have access to information just as much as we have access to information. And to some degree, the tables have turned because now the patients are better tuned to technology more so than the providers are.
Correct.
And so the asymmetry of information, the illiteracy of it is both ways, and sort of this twist of irony. Right.
No,
right. It's like,
that's what we see, right? That's what we see in our company, Hearty. It's a longevity clinic platform. And so what we did at the beginning, we thought we were operating that by ourselves, like having our own doctors. But what we realized is so many doctors now want to join because they want to have the facility to integrate all the technology. They don't have to do the work. They want to make sure they have all the marketing and billing done, and to make sure that you have basically taking care of a community of members, not patients, of members as a whole, to educate them so they don't have to do it. And so I think there is a way right now where, like I said, you shift the paradigm, right, from the doctors have a problem, how can you fix the doctor's problem to make sure that they can focus on what they do best, taking care of the patient, right? And so, yeah, you're totally right. This is a big issue right now. You have to keep up with it, and no one is helping you.
In the back?
Question?
Yeah, I recently found out that my 70-year-old mom had a mini stroke. I'm not sure when it happened. So I've been kind of like bullying her to like change her diet and, she has to swim. I mean, she called me this morning. She went for a walk and she feels so good and stuff. But because we don't live like very close by, the wearables that you were talking about, what's one that I could really get for her so that I can really help to monitor what she's doing, make sure that her, as you said, her blood is, her sugar is good, everything, because I want to make sure that I don't have to bury her too soon.
The great thing now is that a lot of wearables transmits to phones and you can share that data. You might have a little bit more insight to that as far as the data that's consumed by an individual. What is the best way for a caregiver to see that information in order to make best decisions
And which one is good? She had a mini stroke, so which one would be?
She had
She had a
what?
mini stroke.
A mini stroke. Well, first, sorry to hear about your mother. I would say there is no one-size-fits-all tool just yet in the marketplace. I would say that there are organizations in a category called remote patient monitoring, RPM. If you look up that terminology, you'll see organizations like Bioformis and Huma and a handful of others. They're all really good in what they do, but they essentially take an aggregate of a number of different tools depending on the specific condition, and then they actually track and monitor the individual based on those biometrics that they're tracking. So I would look into those types of programs to see if there's something that might be of value there.
Great. Down here? This is a panel. We could have gone all day with this panel. We didn't even get into the internet, medical internet of things and other things, but go ahead with your question.
So my question is riffing off a little bit of something David said earlier about Gen Z millennial doctors may value time more than revenue. So just looking at the last couple of years, across many industries, the workers have gotten more benefits, more kind of like work-life balance. And just contrasting that with the medical field and the medical academic complex, one of my best friends is a doctor, and he wakes up, at 4 a.m. to do surgery, and I don't think he's at his peak, if he had a wearable device, his peak cognition, et cetera. So my question is just, in your circles, do you see, as younger generations are considering becoming doctors, do you see any pushback, or is the existing system going to persist?
I can answer that because as a surgeon, I still get up at 4, but for different reasons. But my health was impacted severely by my profession, right? So as a heart surgeon, first of all, is the stress of the work, and as any other doctor, right, is the workload, right? Like all of us. What I didn't realize is I couldn't measure it, and I didn't crave anything else because I was so passionate by my profession. So what I now advise when I talk to a lot of different medical students, sometimes they call me and say, "Hey, should I go in surgery?" Yes, you should do surgery. Become a surgeon and then do that for 20 years. And so you get this knowledge, you enjoy your life for 20 years, and now you shift. I was overweight, I had hypercholesterolemia, and 2 years ago I just shift because I realized that was my profession that was causing all of this. Mm-hmm. So I reverse my kind of stress-related chronic diseases that probably could have led me to any other, stroke or other event later on. So how do you reverse that? I did that in a year. Everyone can do it. It's free, right? So those young generation, they want to have mission-driven profession. So they are, I think, actively pursuing the idea of helping others, right? Helping the humanity. But they want to do it in an efficient way. They are frustrated by the fact that they cannot save people, prevent diseases, or even cure them because of healthcare issue or billing issue. So yes, we will have a lot of those generation probably thinking about climate change, sustainability, ethics, and so we have to be ready for that. Technology has to be ready because otherwise they're going to say, look, all you guys, we don't want to deal with you.
So I want to add something that's probably going to make me highly unpopular in saying this, but and I just want to caveat in saying if my children ask me should they go into medicine or not, even though I'm not practicing anymore or doing what I used to do, my clear answer is absolutely. Despite all of the burnout, stress, everything that we're hearing, because burnout to me, and we talk about this, we hear it on the news, everyone's talking about burnout, the mental health crisis. Burnout to me is a symptom. And so what you need to do is get to the root cause. And going back to the earlier conversation of this paradigm shift that we're in that takes generally 3 generations for a shift to occur, I'm Gen X, right? So I'm straddling the old world and the new world. Those above me are old world, those below me are new world, right? So the burnout happening for those above me that have been in the system before me are burning out because there's a moral dilemma. They think they're getting into medicine to treat patients, and now towards the end of their career, they're basically just document managers, right? And doing whatever the insurance company. And there's a moral dilemma there in terms of what they thought they were getting into versus not. It's a very frustrating experience. Whereas the younger generation, and this is probably what's going to make me highly unpopular, but I think there's a resilience issue, right? So we want the freedom and the time, but they're still stuck in a system that is demanding and requiring a lot of them, yet they want a different outcome as a result of that. And so they're not, the Gen Zs of the world, for our fault, tend to be a little bit more taken care of. And so, for example, like when the tail end of my residency, they scrapped the whole 72-hour on call. You have to be capped at 36 hours. And, so we weren't trained. If I went above that, my body didn't know how to react and so forth. But there is continuity of care that's required, right? So there are certain elements. So I think we need to address the root cause of some of these issues and really have open conversations around why these are happening. But at the end of the day, I'm an optimist in healthcare, and I would tell my kids hands down to go into it.
What about you, Jess?
I think I would probably vote yes, but with caution. I think medicine is different than it was in the past. I think we're kind of in that mid-shift of where is it going, what is that expectation, and what does that training look like? Because now, yes, we have seen a decrease in hours when continuity of care has now shifted because we're not there that long. So I think that one, I would give two recommendations if my kids ask me that is, yes, because it is a very noble profession. I really do love what I do and how I interact with my patients. And two, I would say, I really, having my MBA and coming out of academic medicine and working more in the wellness and even being chief medical officer of Verywell Health has given me great perspective on medicine and how you can approach it in different ways. And I think even the three of us up here are a testament to that of, yes, you can stay in clinical medicine, you can actually do a hybrid clinical medicine and something else, or you can come out of clinical medicine and still use your expertise in a way that is very helpful to society. And so I think with that, I think those two things, knowing that you don't have to do it the traditional way, and with caution of making sure that they understand what the nuances are. I never got that. And so that journey was on my own. And I think with that, I would be able to say yes with that advice.
Totally
Such
agree.
good
Very
perspective from all of you. And you are all entrepreneurs. You're all doctors. You got into it to help people, but now you're creating things around that, which is so fascinating.